Hi, good afternoon. As people continue to file in, I think I will get started. Good afternoon. Welcome to our March Mid-Atlantic Public Health Training Center Grand Rounds. As always, we have an excellent topic today. Today we are handling a most timely topic that, unfortunately, according to your NHTSA most recent data, looks like almost every one of us needs to be personally interested in this topic, not as scientists, but as individuals on the road. As many of you know, the Mid-Atlantic Public Health Training Center holds monthly grand rounds, and we're here in Sheldon Hall at Johns Hopkins, but many of our viewers are watching us online, and I'd like to encourage everyone watching online to send in email questions that we will get to when we finish and in between all of our on-site questions. And the website to send in those questions is maphtc@jhsph.edu. I'd encourage everybody watching online, please sign in so that we know that you're with us, know that you're joining us. And I'd encourage everyone to check our website to look at our upcoming both in-person and webinar seminars. Those are all available on our website of maphtc.jhsph.edu. So as I was beginning to say, we have a most timely personal and professional topic today of epidemiology of distracted driving. Following our commitment to merging and bridging academia and public health, we have a doctoral candidate who is going to talk about the latest and greatest and most published, or not even hot off the presses, work that he's been doing. And then Ms. Miller is with us to talk to us about the reality of how we really try to keep our roads and our citizens safe. So I'm going to introduce both speakers to you, and then they'll follow one after the other. We are started off this afternoon by Dave Swearin, who is no stranger to this topic, but hopefully has had a good experience here at Hopkins, gaining the skills he needs to go out and be an ace researcher. His work today will be, one second. He comes to us from NIOSH, having worked as an occupational injury fellow there. He got his MPH at University of Michigan. He's worked for the U.S. Army in the area of injury, and he'll be leaving us this summer to do a postdoc at Harvard School of Public Health, along with the Liberty Mutual Research Institute for Safety. He'll be followed by Meg Miller, who works for NHTSA, and has extensive experience in looking at how to keep our roads safe. She works closely with the states in Region 3, especially with interest in North Carolina, and she comes from a background in community traffic safety and working both at the Carroll County level and the Maryland Highway Safety Office. She's got her training here locally in Western Maryland, and I'd like to welcome both of you today. So we'll start with Dave, and then Dave, you'll turn over to Meg.
Well, thank you very much for that introduction. I'd like to thank all of you who are joining us online to hear what Meg and I have to say today. It is a timely topic. So thankfully, we got the chance to talk to you all today. So the purpose of my talk today is twofold. One, I need to introduce some of the epidemiology and descriptive data on distracted driving to set the table for Meg's talk. And second, I'm going to talk about some of my thesis research, which is still in process on distracted driving and commercial truck drivers. So rather than go through and break down all the tasks that drivers can perform while driving, I'm just going to give you the quick version of what driving tasks are. Primary driving tasks are directly related to driving. Secondary driving tasks support those, and tertiary tasks are completely unrelated to driving. So distracted driving is any secondary or tertiary task that takes the driver's eyes, hands, or concentration away from the primary task of driving. What's the prevalence of distracted driving? Well, most commonly, cell phone use while driving, or CPWD, has been measured as prevalence for distracted driving. And one of the reasons for this, I believe, is that it used to be to measure cell phone use while driving, all you had to do was look and see who was holding a phone up to their ear. Now, with handheld cell phones, it's not as easy to make that distinction. So you need methods like the Olson study here, where they have video cameras within the vehicles looking at how often people are using handheld, hands-free, or texting while driving. And as was alluded to earlier, the morbidity and mortality came out with a report last week saying that 69% of Americans report cell phone use while driving in the past month, and 31% report texting while driving in the past month. So as I'm a little bit of a pessimist about this topic, I'm surprised it's only 31%, but really and truly 31% of American drivers is millions and millions of people. So this is a really pervasive problem on the roadways, and it's not just a couple of individuals who are having this problem. What's the risk of distracted driving? Well, again, it depends how you measure and define it. So I have here a table that's just different studies looking at the risks of distracted driving phone calls. So in 1997, this New England Journal article looked at telephone calls and the risk for crash. So the odds ratio for crash goes up to 4.3 when talking on a telephone call as measured by Redelmeyer. And as we've gone along, we've gotten more precise measurements of the driving tasks, distracted driving. And come up here to 2009 Olson study, we see that dialing a cell phone greatly increases your odds of crash. Yet, if you look at a hands-free phone call, it would seem that it would have a protective odds ratio. And I promise I'll tell you more about this later, because the Olson study is really important for what I'm going to talk about in the second half of this talk. But the takeaway from this big table is, depending how you define distracted driving, what the exact task you're looking at, and what study you use to measure, you're going to get different estimates for crash risk. Who's affected by distracted driving? Well, in short, everyone can be distracted while driving. And as we just saw from the MMWR report, lots of people partake cell phone use while driving, which is probably the most common distraction. But I want to point out a couple groups in particular here, because Meg is going to talk about this somewhat in her talk. Young males and young drivers who are risk takers are more likely to undertake cell phone use while driving. I know it must be shocking for you to hear that males are risky drivers who undertake bad things while driving. I'll let you calm down and absorb that shock for a second. But the big point about this is that there's a social norms aspect for teenage drivers and cell phone use. So if we're going to address teen cell phone use while driving and young drivers' cell phone use while driving, we have to approach it from the social norms aspect and get them to believe that this is not okay, this is not acceptable. In the lab, it's been shown that older drivers might take longer to cognitively process distracted driving. So this is another way that they're affected by driving, another way that the distraction affects them, and another way we should consider the risk. And finally, workers who drive on the job have less choice over whether or not they undertake distractions. So whereas you and I might say, I'm going to put this phone call off till later, people who either are professional drivers or drive a lot on the job are generally in their cars, they might have explicit or implicit pressure to say, I need to undertake work right now. So they have less freedom of choice over whether or not they actually undertake these distractions. So that's another, it becomes an occupational issue at that point. And so that leads us into the next section, which is my thesis research on distracted driving in commercial truck drivers. First, I have to thank a whole litany of Johns Hopkins professors who have shaped this research. First and foremost, Keisha Pollack, my advisor. And this has been a long time in the process, and we've got the first draft of the journal article just put together, so hooray. For a long time now in the United States, motor vehicle crashes have been the leading cause of fatality. For commercial truck drivers, the population I'm looking at, it's approximately 3.7 fatalities per billion vehicle miles traveled, or that's a common exposure we use in describing the epidemiology of truck crashes or car crashes. And truck drivers have some of the highest costs of injury, occupational injury and occupational illness in the country. So this is a population that we in public health and occupational safety should be looking at. This is the Olson study, which I alluded to earlier, and this is really the beginning of any discussion about distracted driving tasks in the United States. This study is cited in probably a dozen government documents. It's simply referred to as the Virginia Tech Study. So if you ever hear text messaging while driving increases your crash risk by 23 times, that's where this comes from. That's where this statistic comes from. And it's looking at crashes, near crashes, safety critical events for these truck drivers using cameras in the vehicle and motion sensors on the trucks. Now, I listed here, and again, you'll see this report all over this table and all over the place in government reports. It's very frequently cited. But I pulled out a couple things that truck drivers face that you and I might not have to deal with, such as interacting with a dispatch computer really increases the risk of crash. Writing their log increases the risk of crash. Dialing a cell phone, looking at a map, these are things that you and I might have to deal with. And I said I'd come back to this odds ratio that seems to be protective for crash for truck drivers. And I wanted to point out this odds ratio for a special reason is that truck drivers late at night will talk on the cell phone to help keep themselves awake. So, in fact, cell phone conversations for truck drivers are actually a safety measure that they take, whereas you and I might not consider them as a safety measure. Truck drivers are using phone calls late at night to help stave off fatigue-related crashes, which is a major problem that they face. So although it seems like cell phone conversations are protective against crash, this is only in a specific population, remember, that we're talking about. Since 2001, states starting in New York have banned cell phone use while driving, handheld cell phone use while driving, texting while driving. Currently, 39 states in DC ban texting while driving, and 10 ban all handheld cell phone use while driving. At the time of this analysis ended, 23 states and 6 states banned those. However, 2 years ago, the Governor Highway Safety Association, GHSA, put out a report saying that there is no evidence that any of these bans have reduced crash rates. And one of the reasons for this, and Meg is going to talk about this in her presentation, is lack of enforcement. It's not necessarily the fault of law enforcement officers that we're not seeing enforcement. These laws are very difficult for them to enforce. And we, in public health, have to remember that if we're writing a law for reducing some sort of behavior that we don't like, there are people who have to enforce that law. And we're putting a lot of burden on the law enforcement officers. So I just went to LexisNexis seeing if I could find some newspaper articles about this, and I got hundreds of newspaper articles about how difficult it is to enforce these laws. So I direct you especially to the Ibrahim article here looking at distracted driving and implementation of these laws. Since President Obama took office, there's been a lot of action on distracted driving at the federal level, thanks in large part to outgoing Transportation Secretary Ray LaHood. Especially direct your attention here to the 2010 federal ban from the Federal Motor Carrier Safety Administration banning texting while driving for commercial drivers, so bus drivers, truck drivers, and hazardous materials. And that's going to be part of the focus of my research. So the purpose of my research is twofold. One, I want to quantify the number of fatalities and the fatality rates for truck drivers in distraction-related crashes, and two, other individuals killed in distraction-related crashes. The reason for this is that a truck is so large, when it crashes into another vehicle, its mass is somewhat protective to the truck driver and an increased risk to the other vehicle occupants. So that's why we need to look at both individuals in the truck drivers themselves and other vehicle occupants. And second, I'd like to examine the impact of state distracted driving laws and the 2010 federal ban on texting while driving. The data came from FARS. If you don't know FARS, you should get to know FARS. I'd like to thank Meg as the first person I've ever met from NHTSA. Thank you very much for your database. It's amazing. And so we first need to identify crashes involving a distracted driver. And I want to say that these are not caused by distracted truck drivers. FARS does not assign blame in crashes. These are only factors related to the crash. So if a truck driver was on his or her cell phone and his or her truck was struck by a car that was on fire, or the driver was drunk, or the brakes had failed on that other vehicle, my analysis does not capture that. It only talks about crashes involving a distracted truck driver. Yes, in many cases, these are crashes caused by distracted truck drivers, but we can't say every single crash here was caused by distracted truck drivers. We assembled the counts by year and by state, and we used an exposure variable of diesel vehicle miles traveled. Diesel vehicle miles are a statistic that you can get from the Department of Transportation report, Highway Statistics. So we calculated that for each year and in each state. Diesel miles would give us an approximation of exposure for trucks in each state. We conducted descriptive analysis of total fatalities and rates by state and by year. For regression, we used a multi-level longitudinal Poisson with billion vehicle miles traveled as the offset term. ANOVA confirmed that there was a lot of clustering within states versus there's a lot of clustering within states, and as you'll see in the following slides, there's a lot of variation between states. And we used fixed effects for independent variables in this multi-level model. If I had more time, I would tell you why I selected each of these covariates for the regression model, but just know that these are covariates that either affect distracted driving rates or affect fatality rates overall. So please take your time later to come back to these slides when they're posted online to look at where these variables come from and what they are, but just know that these are the variables that we put into the regression analysis. There were 1,007 fatalities to truck drivers in distraction-involved crashes from 2000 to 2010, and there were 3,942 fatalities to all vehicle occupants in distraction-involved crashes. Now I have this table here on the bottom of the slide, and the next two slides also have huge tables on them. And rather than spend time on the details, I just want to give you the impression of how much variation there is between states with these crashes. So, large table number 1, fatalities to truck drivers. Here's the top and bottom 10 rates and counts. Just note that some zero counts here for fatalities to truck drivers. Texas has by far the highest fatality count. Montana has the highest fatality rate. For fatalities to all vehicle occupants, again, Washington, D.C. had 0. Utah had the lowest rate. Texas, Oklahoma, Pennsylvania, California have the highest counts by far. And Oklahoma's rate, I want to especially point out here, is just absolutely astronomical. It's twice as high as Pennsylvania, the second highest rate. It's 127 times higher than Utah's rate. So lots of variation between states necessitating this use of this multi-level model. Across the time period, 2000 to 2010, here are the yearly fatality rates. The average rate is in red for both graphs. Truck drivers on the left, all vehicle occupants on the right. You can see for truck drivers, we peak around 2007. All vehicle occupants, fatalities peak around 2006, 2007. This actually corresponds somewhat to the national reduction in fatalities around the time of the economic recession. So this rate is not overall a surprise, but in 2010 it continues downward when the federal ban went into effect. Model 1 here on the left is the results of a multivariate regression for truck driver fatality rates. And Model 1 is just those variables that were significant in univariate regression. So for this, it was only speed limit, state truck speed limit, and maximum truck length. These are two things that states are allowed to set themselves. So we divide these as categorical variables. We see near statistical significance for the longest trucks, and then the highest speeds, we see near significance. Model 2, we added in the state bans and the federal ban, and again, near significance, not really big significant results for truck driver fatality rates. Same thing here for this slide. This is all vehicle occupants. Model 1 is just those variables that were significant in univariate regression. Speed limit, truck length, state unemployment rate, state cell phone saturation, and the 2010 federal ban were all significant univariate analysis. And in Model 2, we add in the state texting ban and state handheld bans. And the big point here is that the 2010 federal ban had a large reduction in fatality rates due to distraction-involved crashes. So if this is in fact the case, why has this ban been effective when others have failed? The state bans have failed. And like I said, this paper is just in process, so we're still thinking about reasons why this could be the case. Could it have been that the federal ban was just implemented at a time when all distracted driving fatalities were going down? So that's possible if distraction-related fatalities were due to this economic downturn. However, as the economy technically recovered in 2010, according to economists, we should have seen crashes going back up, and we didn't see that on those graphs. Another possible reason is the penalties. Look at the monetary penalties here. These are not insignificant amounts of money. $2,700 to the driver, $11,000 to the driver's employer. So this creates a real economic disincentive to not text while driving. However, an issue with this is that the final rule as written by the FMCSA gave states leeway on when and how to enforce this law. So it's unlikely that all 50 states uniformly in January 2010 started strictly enforcing this law. So I believe it's the case that this federal ban prompted employers, some of whom already had their own programs, but prompted employers to have their own cell phone bans. And this has been shown in the past by Hickman and the group at Virginia Tech to reduce cell phone use while driving for commercial truck drivers. So to quickly conclude, so Meg can talk, fatalities involving distracted truck drivers have been decreasing in the U.S. since 2006. There's a lot of variation between states and fatality rates. State distracted driving laws had little impact on fatality rates. The 2010 federal ban prohibiting commercial truck drivers from texting while driving was associated with a 47% reduction in fatality rates to all vehicle occupants in distraction-involved crashes. And if you go online and you look at these slides, I have 5 pages of references for you to check out if you're interested in that. So that's the end of my slides, and now Meg is up.
Give me 1 second here to get my presentation up here. Dave, thank you so much for setting me up so well. So many of your slides were really good introduction for mine, so I really appreciate that. And everyone who's here and everybody who's online with us, thank you so much for joining us today. I'm really excited to be here. I started my career, as I just realized, putting this presentation together exactly 20 years ago at the Carroll County Health Department, so I feel right at home here in public health. So as Dave said, it's a very timely topic. And in fact, as I was driving over here, looking at my directions, verifying those directions on my cell phone GPS, I said, this is terrible. If the person who's giving the distracted driving presentation is distracted, albeit for a reason of trying to get to where I was going, it's really timely, and it's something that hopefully we will all become a little bit more aware of and conscious of when we leave here today. So as Dave said, certainly distracted driving is a national problem, and as the CDC report that just came out shows, it's an international problem, but we certainly have a large portion of that international problem right here in the U.S. I'll continue to define distracted driving and what it means on an everyday basis as we're getting into our vehicles, and sort of where the rubber hits the road, if you'll pardon the driving pun, best practices and strategies. What is NHTSA doing, National Highway Traffic Safety Administration, and what can you do as public health professionals and as drivers and passengers in vehicles every day? So the distracted driving problem, 18% of injury crashes in 2010 involved reports of distracted driving, and 18% of distracted driving fatal crashes involved a cell phone. Now, Dave was speaking generally for some of his slides. He was also speaking more specifically to large truck drivers, commercial truck drivers. This is the overall statistic. And I think one of the interesting things that I would think with this statistic is it's probably very underreported. If you think about a driver who was just in a crash, may or may not be injured, but is being interviewed by a law enforcement officer, well, what were you doing, at the time of the crash? Well, they're not going to say, well, I was texting my friend, So if there's a fatality, it's very hard to know what was happening prior to that fatality happening, and certainly you can't check, unfortunately, with the person who was killed in the crash. So again, just probably just note that these numbers are probably lower here than what they actually are in real life. In 2011, 3,331 people were killed in distracted driving crashes, and that was up from 3,267 in 2010. And 11% of all drivers under the age of 20 involved in fatal crashes were reported to have been distracted while driving. So what all this is saying is basically distractions have now joined alcohol and speeding as basically the #1 contributors to fatalities in crashes. So now I'm going to ask you to sort of look internally, and you don't have to raise your hands or anything, But just think about these questions as I'm asking them about your own behaviors in vehicles. So while driving, do you think you can look safely away for more than a second? Eat, drink, shave, or engage in personal activities? Text or talk on your cell phone? Answer your cell phone without stopping in a safe place? Adjust your seat, mirrors, AC, GPS, radio, or CD? Listen to anything that requires earbuds? Feel fatigued or drowsy? Or try to deal with children or pets without stopping? So again, didn't make anybody raise their hands, but if you answered yes to any of those questions, you are at risk. And I would add that if you didn't answer yes to any of those questions, you may be in denial or not even realize. But nearly 80% of all crashes and 65% of all near crashes involve driver inattention during the last 3 seconds before the incident. And, I'm sort of making light of this, but it really is a serious issue. I mean, I truly think that people, get in their vehicles and it's such a normal everyday thing. Oh, I'm driving, oh, I can answer my cell phone. And they just truly don't think about the attention that really is involved in that driving task. So again, just a little funny here, and but a reminder that there are so many distractions, not just cell phones. Hopefully you can all read that, but I was having some coffee and putting on makeup when I had to break up a fight in the back seat. Oh, for a second I thought you were distracted by your cell phone. So. And Dave alluded to this, and I'll just go into it a little bit further, but distraction is anything that can take away visual, manual, or cognitive resources from the driving task. And there are some studies out there that also count auditory distractions, but most of the studies really kind of focus on these 3 types of distractions. So visual, taking your eyes off the road, and glancing away from the road for even 2 seconds significantly increases your crash risk, as Dave just mentioned. Manual, hands off the wheel. So GPS navigation system, holding an electronic device, adjusting the car radio or a CD player. I think that's one that people don't think about a lot, but that requires several different types of distraction. Eating or drinking, personal grooming. Cognitive, thinking about something other than driving. So again, not necessarily having your full focus on the road, but, thinking about the fight you had with your significant other this morning, or something like that, So 3 different types of distraction. I'm not going to say anything about this slide. I'm just going to let you go ahead and concentrate on that for a second. But basically, what this is showing is that multitasking for the brain is basically a myth. The human brain can't perform 2 tasks at the same time, and it handles tasks sequentially. It switches from one to the other. So I have to give credit. I totally stole that slide from a colleague at the National Study Center for Trauma and EMS, but I really think that kind of breaks it down really well. And there's a spectrum of distraction. So, listening to the radio would be considered a minor distraction. A distraction, but a minor one. Whereas texting is really one of the riskiest forms of distraction because it involves all 3 types. You're taking your hands off the wheel, you're taking your eyes off the road, and you're thinking about what you're texting, and you're not thinking about your, driving abilities. And at 55 miles per hour, a text actually takes your eyes off the road for an average of 4.6 seconds. Seems like an instant, but at 55 miles per hour, this is the equivalent of driving the length of a football field blindfolded. So once you really start thinking about that, it's major distraction. This slide kind of speaks to the situation that Dave was talking about earlier, that it basically shows, okay, everybody is being affected by these crashes. Male, female, drivers, passengers of any age, vehicle types, it's pretty evenly distributed among who is being involved in fatal crashes. That being said, the 2010 observational survey of distracted driving found the following. Handheld cell phone use continued to be higher among 16 to 24-year-olds and lower among drivers ages 70 and older. also higher among females than males. But again, once you get right down to it, distracted driving crashes impact men and women, people of all ages, vehicle types, as illustrated here. So this is one thing I love about public health folks is you want to know what you can do to get out there and address these issues. And as you know, any public health or safety issue, it's not a one person, we all have to be a team and everybody needs to work together. So can't be tackled alone. So again, I really appreciate you all sort of delving into this issue. And so now I'll tell you a little bit about what NHTSA is doing and really what you can do as public health professionals. The GHSA study that Dave referenced it was sponsored by a grant from State Farm. It was published in July 2011, and it sort of went into what can states do. So one of the things, again, using a team approach, continue to implement effective low-cost roadway distracted driving countermeasures such as edgeline and centerline rumble strips. So this we have to rely on our partners in engineering. The person, as we try to change people's behavior, even if we can't necessarily change that behavior, if they are, veering off the road and they hit those rumble strips, that's going to help them course correct, hopefully. So that is certainly one of the countermeasures that is recommended to continue. Record distracted driving and crash reports to the extent possible. Again, knowing that there are some limitations to that, but to assist in evaluating distracted driving laws and programs. And again, we suspect that there is probably some underreporting going on, and that is something that everybody's working on. Monitor the impact of existing handheld cell phone bans. That, as Dave said, there are new laws every day. We're continuing to look at those. There is a model law that is included on the Distraction.gov website and that GHSA promotes, but there are some limitations to enforcement, as he said. It's a tough law to enforce in many cases. And then evaluate other distracted driving laws and programs. Certainly any program in public health, that's one of the constants. You have to evaluate and decide what's working and what's not, and then focus your efforts in the areas that are working. So with that, just a little bit of information about where you can find your state laws. As Dave said, 10 states plus DC, Puerto Rico, Guam, and the U.S. Virgin Islands prohibit all drivers from using handheld cell phones while driving. Maryland is one of those states, but to add to the challenge for law enforcement, it is a secondary enforcement law. So that means a law enforcement officer has to see you do something else. So whether that's, veer into another lane or if you're not wearing your seatbelt, something like that, they have to see some other infraction before they can pull you over simply for the handheld cell phone. So it's a challenge, and I'm going to talk a lot more about some of the countermeasures that we're doing, and they all involve law enforcement, and they are certainly some of the best partners that we have at NHTSA, but they have challenges, and so that is something that we're trying to overcome. So we've got our Department of Transportation activities, and as Dave said, Secretary LaHood this is really one of his items that he's so passionate about. And I'll just read this because I think it breaks it down to its finest point. Every time we climb into the driver's seat, we all have a responsibility for keeping our roads safe by putting away cell phones and other distractions. I mean, truly, what distraction can't wait? What cell phone call can't wait until you're pulled over someplace safe? So the federal ban on texting for commercial truck drivers, as we see, has been a very successful ban. The federal employee texting ban by executive order. There's been a public awareness campaign, which I'm going to go into here shortly, and the NHTSA Driver Distraction Program Plan. So a copy of NHTSA's Blueprint for Ending Distracted Driving, which was just released in June of last year, is posted on Distraction.gov. So lots of great resources out there. In any public health campaign, particularly when it involves traffic safety, we use both social norming and enforcement messaging. So the social norming is basically, trying to communicate the call to action to just put it down. And the enforcement messaging, which was tested in some demonstration projects, which I'll be talking about in a minute, just alerts the public to not necessarily, a lot of times people don't necessarily think they'll get into a crash, but they think they might get ticketed. So that's sort of where the enforcement message, phone in one hand, ticket in the other, comes in. So NHTSA's Driver Distraction Program Plan. Our goal is pretty simple: eliminate crashes due to distraction. That being said, it may be simple, but it's certainly not easy. And so we have a four-pronged approach that we're working on to try to do that. And again, it involves so many partners. So we appreciate your partnership. Basically, the approaches are: Initiative 1 is to improve our understanding of the problem, help with the reporting and get better data sets to look at. Reducing distraction from in-vehicle devices, keeping distracted drivers safe, and that's, again, sort of the engineering model within the vehicle, and then improving driver behavior. And that's my position at the regional office is really, we're very much on the behavioral side. And as we know, changing people's behavior can be very, very challenging. So the data initiative is really to refine the data, create new data sets, and look at the problem. So I think you'll really appreciate what I'm about to say. So there was a representative phone survey that was taken, and more than half of respondents indicated that they believe using a cell phone and or sending a text message makes no difference in their own driving performance. Makes no difference in their own driving performance. I want to emphasize that. However, as passengers, 90% said they would feel very unsafe if the driver was performing those same behaviors. So it's the old, it won't happen to me syndrome, or, oh, I'm such a superior driver. So, this is kind of the attitude that we're dealing with. It's okay for me to do it, but it's not okay for everybody else to do it. Moving into the vehicle initiative, this is to make sure, that the automobile manufacturers, they're putting so much into the vehicles now to make our lives easier, really, but then also that provide a lot more distractions. I can't remember what kind of vehicle it was that was, showing their touch screen. Everything's on a touch screen. And so NHTSA is working with the vehicle manufacturers to ensure that as they put more and more of these in the vehicle, that they're looking at human engineering and human factors and making sure that they're not creating, in trying to make our lives easier, that they're not creating more distractions and more dangers. So this is also related to the vehicle manufacturers. And basically it's looking at advanced crash warning and driver monitoring technologies to help avoid crashes caused by distraction. So again, anytime if you can have an engineering fix that doesn't require driver behavior to change, so much the better, because it's a completely passive kind of protection and they don't have to change their behavior, which we know can be very difficult to do. So that is another part of the four-pronged plan with the distracted driving. And then the behavioral part. So this is what's kind of most exciting to me is yes, it's challenging to change people's behavior, but it can be done. And we've seen that impaired driving is a great example of that. 20 years ago, it just wasn't, you didn't even think about it, or, and now we've had a total culture shift where it's not okay. And I'm hoping that culture shift will extend to making it not okay to be distracted while driving as well. So this is, the strategies and countermeasures that we're using to modify driver behavior. So any project that we have at NHTSA essentially is modeled after, at least for distracted driving, is modeled after our click it or ticket model. So it's called high visibility enforcement, and you've got a defined period of earned media. So, let people know, okay, this is coming. This is sort of your warning, in effect. A defined period of paid media with an enforcement message. Okay, we got the press releases out there, we got the earned media, now we're actually putting paid media ads, based on the model, based on our high-risk demographic, and then a defined period of enforcement, and then evaluation before, during, and after both the publicity and the enforcement. So that is our click it or ticket model, and it's been applied in several demonstration projects to the distracted driving model. So, for instance, the first demonstration project started in April 2010 in Connecticut and New York. And there are current high-visibility anti-texting enforcement projects back in Connecticut, Massachusetts, Delaware, and California. So we're sort of in a constant state of trying to run these projects, evaluate them, and then the lessons learned then will be shared with the other states. So again, the lessons learned in those first two demonstration projects will probably not surprise you at all, especially based on what I told you earlier. So the survey showed that motorists are willing to use their cell phones and text while driving, yet believe that it is important for the police to enforce handheld phone and texting laws at the same time. So again, get all those other crazies off the road, but I'm okay to do it. And this is a quote from the report about this, and I think it sums it up very nicely. Changing drivers' assessment of the risk associated with their own behavior is a challenge. So the bottom line with those two demonstration projects was that self-reported use of a handheld cell phone or texting while driving did decrease in both test sites at the end of the fourth enforcement wave. So there was definitely some success in terms of people recognizing the messaging, people reporting their use. And again, it's self-report, so you've got to take that into consideration. But there was definitely a significant difference and decrease in the use. So other tools, I've referred to Distraction.gov a lot in this presentation, and that's where I got most of my data. It's one of the first websites that's solely dedicated to a particular topic, and it is just rich with information. It's got the sample law, it's got, if you want to do a campaign of any sort, it's got all sorts of flyers, downloadable information. It's just really, it's a great site. So I highly recommend it and hope that you will use it to follow up. So that's a lot of information, but really, and what I said was that I would tell you really what you can do. And I think part of this is an ever-changing field. There are constantly more and more distractions. So it's something that we're all still learning about, but there are some concrete steps that you can do today after you leave here. Here in Maryland, you have a wonderful resource in your regional traffic safety program coordinators, which work with the Maryland Highway Safety Office. And I would encourage you to go to the website for the Maryland Highway Safety Office, which is mhso.mva.maryland.gov, or you can just Google MHSO. There are regional traffic safety program coordinators in each of these regions. They have regional task forces which work on exactly these issues. They work on distracted driving, occupant protection, impaired driving, speeding, and it's a great partnership. They've got engineering represented, they've got law enforcement represented, and maybe many of you already are working with them, in which case kudos, and I'm really glad to hear that. But if not, definitely reach out to them and see, how can public health fit in. So as public health professionals, you are the leaders in saving lives and preventing injuries. And as parents and grandparents and aunts, uncles, siblings, friends, you're the role models in your own vehicles. So you can take the pledge. This is located on Distraction.gov, and it's just a simple reminder, that this is what happens, and we can do something to prevent it. So again, Distraction.gov has the pledge. This is something that I talk to my friends about a lot, and so just something simple that you can do. If there are 3 takeaways that you go away with from this presentation today. 2 of them are to visit GHSA.org and Distraction.gov, because they both have a wealth of information, more than I could cover in this amount of time, on distracted driving. So I do encourage you to check those out. The other thing is always wear your seatbelt and require your passengers to do so as well, because that is going to be your best defense against an impaired, distracted, any other kind of driver. See if your employer has a distracted driving policy. This might not be something that you would necessarily think about, but it would be interesting to note if they don't, and if they do, what is the policy? And if they do, see if it's enforced. If they don't have a policy, that's something that you can work on. Make sure that that's in place, so people within your organization realize this is a priority. We want our employees to be safe. We value you. It goes without saying in a distracted driving presentation, never use your cell phone while driving, and also never speed, because certainly that has lasting consequences as well. So again, thank you all so much. I really appreciate it. That is the end of my formal presentation, and I know we have some questions that have come in, so thank you.
Hi, we have a lot of online questions, but I'd like to take questions from those in the audience first. Again, for those of you online, I'd like to remind you that you can email me in questions at maphtc@jhsph.edu. Okay, the woman here in the front row, please.
Yes.
What do you think the biggest areas of research that are needed surrounding this problem?
Excuse me, that's a great question. I think the law, monitoring the laws and seeing, as Dave mentioned, how they're being enforced, whether they're effectively able to be enforced, is certainly one of them. These demonstration projects that we're doing with enforcement certainly are being monitored and evaluated. And I guess if there are other innovative programs out there that people are coming up with, and any countermeasures that are being done certainly need to be evaluated. And I'm sorry that I can't give you much more specific information, but I think all of them are being evaluated, and I hope that you can get involved in helping to do that.
Go ahead, please.
Hi, I have a comment and a question for Meg. So I do work in global road safety. Most of my work is in low and middle income countries. And we use NHTSA as an example of a really good road safety agency. And the reason we use NHTSA as an example is because it successfully in the 60s managed to change blaming the driver to actually trying to change the system. With the emergence of distracted driving so high on the agenda of NHTSA and the CDC, I sort of worry that we've come around a full circle and we're back to blaming the driver. And the reason it worries me is because we look at law enforcement now as our biggest tool, and a lot of people, like me, I hate to be having to deal with cops. It's a really scary thing. And it may have something to do with my skin color, and it's not even that dark. The US has a really miserable history of how law enforcement treats people of color. There's a million different ways to slice up the road safety problem, and distracted driving has to be a big issue, but that wasn't the only way to solve the road safety problem in the country. And NHTSA is famous for having taken different sorts of approaches, with designing better cars, designing better highways, focusing on the environment so people can't drive fast. So could you comment on that a little bit?
Sure. First of all, thank you for the compliment for our agency. And I think that is one of the, enforcement certainly is a key piece. That being said, I think if you look at the distracted driving plan, we are working with the vehicle manufacturers to make sure that human factors, again, when you can use those engineering modes and methods to try to help folks not even have to think about something, and it just gets taken care of for them. That's definitely the way to go. And I probably emphasize enforcement so much because that is where my background is, in terms of what does help in many occasions. And we have found through studies that law enforcement of, say, seatbelt laws, impaired driving laws, really that has been the countermeasure for those topic areas that has really helped to lower the numbers. And so they are applying that model to the distracted driving area. But certainly any methodology used alone, is going to have some failings. I'm not sure if I'm addressing your answer fully. Certainly the law enforcement that we work with, they want to make sure that they're applying the law to everyone equally. But I understand where you're coming from, and if we are working with law enforcement that are having such problems, there was grant funding to look at racial profiling issues a couple years ago. So that's certainly something that would not be tolerated in terms of grant-funded projects. But yeah, I think this is an area that we still have a long way to go in terms of not always blaming the driver and trying to work through some of those issues in an engineering way. And so that's why the Initiative 2 and 3 really are working with the vehicle manufacturers. But maybe that's where some of this evaluation can come in. What is going to help in this area the most? Is the enforcement angle going to work as well in occupant protection or in distracted driving as it has in occupant protection and impaired driving? And it may not, and that's why we're still learning. So, I welcome any additional comments or suggestions. Certainly I will take back.
Well, I actually do have something off that. There was a study done recently in the past couple years about racial profiling involving primary and secondary enforcement of seatbelt laws. So if that's possible to do, I'm sure it would be possible to analyze enforcement of handheld cell phone laws in a similar way. Is there a racial profiling component to this? So yes, that has been addressed in other issues, and I'm sure it could be applied here.
Before I get to your question, I just want to ask a couple questions that really are related to that. In Injury 101, we kind of teach there's a hierarchy of controls, and we do ultimately teach that the least desirable way of controlling adverse health effect is by controlling it at the level of the individual, and enforcement really is at the level of the individual. If you'd comment on that. But along those lines, I just got a new cell phone, and it's got this woman in it named Siri. And I wonder if, as you're working with, when you're looking at engineering out distractions, whether manufacturers of phones or gadgets in cars are really looking at voice activation as an easier way of minimizing distraction.
A great point, and that is part of the third initiative. I think they're not only are they looking, when I say they, NHTSA and vehicle manufacturers are looking at the in-vehicle distractions, but now NHTSA is looking at working with the sort of aftermarket, the cell phone manufacturers, the aftermarket GPS manufacturers, to see if there are ways, again, that those can be engineered to be less distracting while you're in the vehicle. I've heard people say, would there be any way to basically have an interlock type of system that, if you answer that cell phone, then, your vehicle, basically you wouldn't be able to operate the vehicle or operate the cell phone while your vehicle is in motion. I don't know if that's something that would ever be looked into or be even at all practical, but I mean, there are definitely, they're looking at more and more engineering fixes, because you're right, when you get down to that individual level, and let's face it, sometimes that works, sometimes the threat of getting a ticket That's another piece of why when they do the high visibility enforcement, not everybody's out there getting a ticket. I mean, the ideal would be you've got this media component that's saying, well, it's likely that you're going to get a ticket, and that's going to make you do the right thing. So whether that be put on your seatbelt, not drive impaired, or not use your cell phone with the fear of getting a ticket, and so that is something that we try to use that high visibility portion to get people to do the right thing on their own.
So Dave, along those lines, is there research on in-public awareness campaigns in general, whether the actual threat, i.e. I'm going to get in a crash, is more or less motivating that, oh my goodness, I might get a ticket?
There is some research on that, and a lot of it depends on how the message is presented. A couple years ago in Great Britain, they did a targeted media campaign towards teenagers, and it was very graphic crash videos, and it was extremely graphic crashes with teenagers, shattered glass everywhere, blood, crying people, and that's, I mean, is that effective? When I first saw these videos, I'm like, that's pretty effective to me. I can't think of any exact measurements of those off the top of my head, but as long as you know who you're targeting and accurately targeting those populations, like that picture that Meg showed towards the end, tell my son that I was just looking away for a second, something like that. That says it's no longer my problem. It's this child he's got a helmet on, he's on his bike. I have hit someone else now, and you're trying to get them to think outside. So I can't tell you off the top of my head any studies like that, but such evaluations do exist.
And I would just add on to that, and even when dealing with teens and a lot of the risk-taking adults that are sort of in the typical distracted driver or person who's not going to wear a seatbelt, is typically that message. And it might get through to some, so that's why so many different approaches are used. But it's the enforcement message and the fear of getting a ticket and having to deal with whether going to court or paying court costs and possibly getting points on your license, that kind of thing. That typically seems to be what motivates people more than the crash.
And not to beat this question into the ground, but there are third-party solutions you can add on to prevent distractions. So those people who are self-selecting to avoid distractions, there are ways to do it. Like some trucking companies, for example, have the GPS in the truck tied to the computer, and the truck has to be stopped for a certain amount of time before the computer will even turn on. So there are engineering solutions for these things. It's just that, and many times you have to select into that option. So if insurance companies got really interested in this and said, we will insure you if you add our program X, that might be another way to incentivize using these self-selecting preventive measures.
I am a facilitator at my kid's school, and we do parent-kid facilitations, and we just finished watching these videos on horrible crashes. And what was fascinating was how devastated the parents were and how the kids giggled. But because they didn't believe it would happen to them. But what did come up in these discussions was going back to the point you did make on social norming. And one of the mothers had said that her understanding of the literature, she's a social worker, was that just as in drinking, teens have reduced their driving while drinking because of social norms. She feels, or the social work literature suggests, that only before social norms start, don't let your friend drive distracted, will things change.
Yeah. Well, I have a good friend of mine who I know the password to her cell phone, and if she's driving and goes to pick it up, I just pick it up and open whatever she's going to do on there for her. And it's a social norm thing. If I'm in the car with someone else, even a semi-close friend, I'll ask, please don't text while driving. Please don't look at your GPS while driving. I can hold it for you. I can read the directions. I mean, it's not just personal responsibility for yourself. It's responsibility as a passenger.
Absolutely. And I do think that the more, we can all do that and then sort of spread the word to our friends and family, and every little bit helps.
Did you ever go ahead? So I'm just going to repeat for the audience. She'd like to know, Dave, how you determine whether a driver is distracted or not in your data set.
Well, thank you. I would have spent more time on that had I had a full hour to describe my research to you. But from 2000 to 2009, we had to use the driver-related factors variables in FARS. There's up to four driver-related factors, and each crash can be coded in FARS. And the article I cited by Wilson and Stimson gives a method for determining distraction in those years of the database. In 2010, FARS was modified to actually include a distraction variable. So you can now go into FARS directly and select, was this driver of this vehicle in this crash distracted? And you can select cell phone distractions, passenger distractions, other types of distractions.
So is that based on a police report, or how does that?
Yes. Now that's the question. How are these validated? And many variables in FARS have been validated, and I do not know of literature on the validation of the driver distraction variable in FARS. And I mean, that would be a limitation to all these studies that I cited using FARS data on distraction. But so far that's what we use, and someday someone is going to have to validate the FARS distraction variable.
In one question, while we're talking about sort of databases, why is your database use a blood alcohol of 0.08 when for DOT it's 0.04?
Oh no, that was just a covariate in my analysis. I didn't pull the blood alcohol of the drivers. I was only pulling counts of crash victims. And what I used in that analysis, and hopefully I'm going to get this paper rolling soon, and so it can be in publication and we can see the better description of the data, but these were states that did or did not have 0.08 laws in a given year. So by the end of this study in 2010, every state had a 0.08 law, and that we know reduces total crash fatalities in a state. But at the beginning of the study period, not all states had a 0.08 law. So that was what that variable was measuring. I did not have this study set up so that I could say this driver was distracted, but really they were hammered, and that was the cause of the crash. We're just looking at for distraction-involved crashes. So we're not, like I tried to emphasize on that one slide, we're not assigning blame to distracted truck drivers for all these 3,942 deaths. We're saying there are 3,942 deaths involving distracted truck drivers in the United States in that study period.
And then building on that concept, someone asks, what is the connection between DWI and distracted driving?
Oh, I mean, there definitely are people who undertake both, and it's been shown that studies, I believe University of Utah scientists have done a lot of lab research on comparing distracted driving to drunk driving, and it does magnify the effect. And also distracted driving and fatigue driving, there's also a magnified effect of both. So I could not speak to saying which is worse, and if they're together, how much worse it is. If it's 10 times, is it 100 times worse? I don't know, but yes, there are studies comparing those types of situations.
Great. I think I saw a question.
Tom?
Oh, go ahead.
So, Dave, you mentioned insurance companies, and I wanted to ask you, do you think they're really taking this seriously? And what else can they do? It seems like they could provide a lot of disincentives.
So the question is, what have insurance companies done to date? And the comment that insurance companies could probably provide a lot of the disincentives to these behaviors.
Last year I gave a talk at the annual meeting of the Association for the Advancement of Automotive Medicine, and one of the things that our study found, I was working with Sue Baker and Steve Bowman on crashes and fatal crashes to teenagers, also FARS data because it's the best. And we found that females were more likely to text than males. And one of our conclusions was, well, maybe we need insurance companies to really come down as the non-governmental enforcement, because one of Sue's major conclusions from this whole study was that young male teens are really bad news, and we're not even beginning to describe how bad it is. And well, we can't really just deny licenses to 16-year-old boys and give them to 16-year-old girls. So we should. So I said at the meeting, we should think about bringing in insurance companies to do this kind of thing. And some representatives from insurance companies got up and said, we do this, we do this, and they're aware of the problem. Is there economic incentive or disincentive for them to place a real burden on distracted driving or require extra anti-distracted driving measures? I'm not sure, but I definitely believe that we should be talking with insurance companies about this, as they are basically the last line between licensure and driving. You have to have insurance, and so the insurance company is the gatekeeper. And if we want to have a conversation about this, we need insurance companies there with us.
But I guess to take Tom's point one step further, at least for those of us who are not in the insurance business, one would think that distracted driving costs insurance companies money. And so one would think that they would have a lot of incentives to do a lot of different things to prevent it.
That's right. I mean, if I was David Bishai and I did a econometric analysis of crashes, I would be very much interested in following what's the cost benefit to texting policies and this sort of thing, and that would be one way to follow this up. That's not exactly what I do and not exactly what I study, but I think there's definitely an argument to be made about what's the cost of distracted driving crashes to the individual and to the company, and how much money would you save if you made every single driver add on a third-party software to their cell phone.
Another audience member asks, sort of along these lines, who are the stakeholders in this game, and specifically, why when states have laws that make it only a secondary offense, what prevented those states from making it primary offenses?
Great question. It basically boils down to what happens in the legislature as far as what laws become secondary, what laws become primary. And there are very few currently in Maryland that are secondary. I think it's just our distracted driving laws and I believe the windshield wipers on when it's raining, or lights on when windshield wipers are on. So that being said, our seatbelt law started out that way. That's been primary enforcement now for over 10 years, and so people, there's really not even a second thought of why it wouldn't be primary to begin with. But there are many different things that happen sometimes. I know, for instance, when Maryland was trying to change its seatbelt law, to become primary. For instance, the taxi cab drivers associations were lobbying against that, even though at the time they were actually exempt from the law anyway. But so there are different stakeholders, and it's hard to say why one might be against one particular thing. But basically, what gets passed is what reaches the compromise in both sides of the legislature. So I think at this point, it's basically a matter of, getting the laws that we have on the books to be enforced, and again, also coming in with this social norming message of, it's not okay to do this.
Let's see. There's so many questions here. I'm trying to see how I can.
Wow.
So another question asked is, we talk about distraction as in, you talked about visual and manual and perhaps auditory. What is the literature on how does one maximize cognition on the road? It seems to me, as someone who does urban driving, it's so easy, to get distracted because we're in stop and go. But also as someone who's driven on long highway rides, it's so easy to get distracted. What has been demonstrated to actually be useful in keeping people's minds on the road?
I'm not sure I can answer that question, Dave. Do you have
I think the only thing that I can think of tangential to that is the new fatigue warning systems that you're seeing in cars, and a beep or a bing every once in a while to bring you back. But I also don't have insight into that. There's a lot of work done or a lot of the groundwork for this was done in aviation and pilot distraction 30, 40 years ago, and that really informs what we're doing today. But if there's something about distraction warning systems or things like that, maybe looking at the lab work on human factors in pilots could be one way to look at that, but I don't have any special insight into that.
So my husband's solution is to wear shorts and put a can of some cold beverage between your knees. Go ahead.
Which can be another type of distraction, but
Go ahead.
I have a question for David. David, you mentioned that the effect of the truck cell phone ban happens at a time when there's large secular trends in road safety data in the U.S. anyway, which is really worrisome because it's not clear if the declines are because of declines in all road traffic factors. Have you tried controlling for secular trends by, for example, using road traffic fatalities among car occupants as a control?
So the question is, given that there are secular trends in reduction of fatal crashes anyways, Dave, how have you looked at controlling for those secular trends in your data?
No, I haven't looked at that, but if this was solely dominated by the secular trends, the economic recession, which have already been shown in 2008 and 2009 to show big decreases. 2010 is when the economists are saying technically the recession ended, so crashes should be going back up. And as we saw in those graphs, they weren't going back up. Unfortunately, let me follow that up by I'm using the year as the level of analysis here. So I would much rather be able to look at monthly or weekly trends in crash rates and see how they're affected, seasonality or things like that. But because I only have 1,007 crashes in truck drivers across 50 states across 11 years, we're starting to divide up those cells, starting to get smaller and smaller. And although we're having over 100 crashes in Texas for truck drivers over the entire study period, we're starting to divide it down to a point where we're not going to see the results across longitudinally and across all these different clusters at a time. So although I would like that kind of analysis, I don't know if I could carry out that kind of analysis. And I see exactly where you're going with it, but I don't know if I can do that.
The truck accidents didn't go back up. Did car occupant accidents go up?
I looked for data on that and I couldn't find any. I don't know.
2011, I believe, was our lowest year on record in terms of all vehicle fatalities. 2012 did show an uptick overall. So it may be that if 2010 was sort of like when the economists are saying the economy started bouncing back, but really things didn't start picking up maybe until 2012 in terms of VMT.
There's been a downward trend in fatality rates since the late 70s anyway. So.
Do you ever show that the trucks are doing better relative to cars, for example?
I have no idea. I can't answer that.
Are there any databases? I'm sitting here thinking about how we love to measure mortality because it's so final, and morbidity is so difficult to do. I wondered whether the insurance companies keep databases on how many repairs cars go in for repair, and whether that's a much richer source of certainly numbers of crashes.
Well, there was in the Governor's Highway Safety Association report, there were studies done using insurance company data, and they showed the similar decrease or no effect for these fatality or for these crash rates. So yes, insurance companies are a source that we could go to for this. I've only seen 2 studies doing this.
Because you could argue those are near misses.
Well, I mean, we're not even getting the near misses. We're getting just the worst crashes. We're not seeing the injury only crashes, and we're not seeing the property damage only crashes. We in the entire injury pyramid, we're missing the no injury, the near misses. So.
Right. Well, and that's why the insurance, comparing your data to insurance company data would give you 2 ends of the spectrum, because those are crashes with potentially no injury.
Yes.
Other questions? Well, the timing is perfect because I've gotten through all my questions as well. I'd like to thank you both very much for this timely discussion. This discussion will be archived on the web. It usually takes us a few weeks to get the technical glitches out of it. I'd invite you all to watch. I look forward to, Dave, your papers being published, and Meg, you solving this problem for us. And,
I'm working on it.
And I hope you'll all join us next month for our grand rounds next month. Thank you very much.
Thank you.